Hello, my name is Benny Do, and I'll be a screen nurse for today. My badge number is 136081. Here's my badge, in case you don't see it. Today we'll be doing a physical health assessment with my patient back here, and we'll get started. Before that, we're going to do a quick 360. Here's the place. This is what we're dealing with. All right. And here's my equipment. I have my gloves, my stethoscope, some alcohol wipes, sanitizer, and some water, as well as other equipment for the assessment. I am now going to place the camera. All right. Thank you. All right. So I'm gonna get myself ready. I'm gonna put some sanitizer. Put on my gloves. Put on my gloves real quick. All right. I'm gonna put on my stethoscope and use some alcohol rub on both sides. I'll warm it up before also seeing with the patient. Got some water and my equipment. All right, we're ready to go. Hello, Mr. Rex. Welcome to your assessment. You're here.
Hello.
Yes, hello. We're here to check on you and make sure everything's okay. You said you just wanted a small checkup just to make sure I know you're a healthy man and take care of yourself. Now we're going to do so accordingly. My name is Whitney. And like I said with the assessment, do you need water? Do you use the washroom?
No, I'm okay. I'm okay.
All right, cool. No water, no washroom. Patient consents. It's okay with you to do
Sure.
this?
Okay.
All right, close the curtains. Let's go. All right, so before we actually even start, I need to confirm your ID. So, Ms. Rex, when were you born?
It's July 6th, 65.
And what is your last name?
Ohini.
All right, thank you so much. All right, so now we're just gonna do a general survey. First, we'll look at his outer appearance. He has no odor. He looks appropriate to his age. He is middle age, and does look like that. And his skin is uniform. Now we're going to move on to body contour. His position, yes, his position is upright. He has a great posture. Can you stand up real quick for me? Can you stand up? His height is appropriate. There's no deformities or or everything looks symmetrical. Please sit down. Thank you so much, Mr. X. And then we're going to move on to behavioral. From what I can see, his facial expression is calm, relaxed, he's content. He is speaking appropriately. He doesn't seem disoriented. He maintains eye contact. And his mood, he seems happy. Is that true, Mr. X?
Yeah.
I think it seems like
Happy
he can be.
man.
Awesome. From his work of breathing, you don't see any use of accessory muscles or heaving or use of accessory muscles, no deep breathing. And now I'm gonna check for your LOC. For what I can see, he does seem awake, alert. We'll check his orientation. Do you know where we are?
Oh, yes. We're in the clinic.
And what time is it?
It's 10:30.
Wow, let's get going. All right, general survey is done. We're gonna start with the head and work down to the face, neck. Then we'll deal with the thorax, the heart, and the muscle, and abdomen. So just by inspection, we can tell that his head seems it seems symmetrical. There's no deformities. There's no masses or lesions or discoloration. I'm just gonna palpate real quick. I'm gonna come over. Let me know if you feel any tenderness or pain. All right. Do you feel any pain? All right. So as I'm inspecting, there's no tenderness or pain. There's no discoloration. There's no lumps, bumps, or lesions. His hair looks evenly distributed, and his head shape is cephalic. That's good. So now I'm gonna move on to the face. The face looks relaxed. As I see his eyes and his eyebrows, and just overall, I can see there's symmetry. There's no ptosis or dropping of the eyelids. His eyebrows and eyelashes are evenly distributed. Thank you so much. The skin looks uniform. There's no discoloration. There's no scars. He looks pretty happy. Now we're going to touch cranial nerve number 7, which is the facial nerve. All I need you to do is just listen to my instructions, and we'll do so accordingly.
Okay, sure.
All right, thank you, Mr. X.
Yeah.
So can you please smile? Thank you. Frown. Shut your eyes. Shut your eyes real tight. All right, thank you. Now I just need to test your resistance. I'm going to need you to puff up your cheeks. Thank you. Now I'm going to check resistance. Awesome. This guy is good. Okay, now we're going to check the nose. I'm going to get my pen light over here. Okay. And can you please raise your head up for me, Mr. Rex? Alright, as we can see, the nose, this hair is evenly distributed. The mucosa is appropriate color. There's no drainage or polyps. The nose is symmetrical and doesn't seem to be having the signs of distress when breathing through the nose. We're just going to quickly check the nose patency. Mr. Rex, all I need you to do is breathe in and I block one nostril, and all I need you to do is breathe out. No, I'll do it for you. Thank you. Alright, so breathe in. I'll block one nostril, breathe out. Through your nose. Alright, good job. Other side. Breathe in, breathe out. Alright, so there's no looks like distress or any problems or any problems with breathing. Looks like nose patency is 100% as well. I'm just gonna quickly check his lips. His lips are symmetrical, they are moisturized and appropriate to the color. Mr. Rex, I'm just gonna check your pharyngosal nerve just by assessing the uvula and the soft palate.
Let me sit well because the camera is putting this like. No, it's not. So you can see, otherwise you can't see your
Yes.
face.
Alright, so we're just gonna check your lips real quick. Alright, so the lips looks again symmetrical, there's no discoloration, it looks moisturized. I need you to see the back of your throat, which is actually the uvula, so I'm going to tell you to lift your head up, thank you, and stick your tongue out for me. I just need to see the back of your throat actually. Alright, thank you. You can see the uvula, there's no inflammation, there's no tonsillitis. Alright, I'm going to need you to say please. Alright, good job. So as we can see, the uvula is moving as well as the soft palate. I'm going to test your hypoglossal nerve as well. I'm going to need you to stick out your tongue. Your tongue, please, and I'll expect. So we have a thin white coat, there's some papillae. I'm going to need you to move your tongue side to side for me, please. Thank you. And now please say light, tight, dynamite. Light, tight, dynamite.
Light, tight, dynamite.
Alright, hypoglossal cranial nerve is intact. I'm going to quickly check the ears. The ears, there's no cerumen. The external canal is appropriate color. There's no discoloration or bumps, lesions, or masses. As I'm palpating the tragus, the lobes, and the helix and the antihelix. I'm going to quickly do the other side. Okay, I'm going to quickly do the other side. Alright, no tenderness, no pain, nothing. Alright, there's some discoloration, there's no cerumen. It looks like everything's intact. I'm going to end with the eyes and assess the perla. Just by looking at him, I can tell that the eye pupils are symmetrical. His iris is the same color, the sclera is white. I'm going to need you to look up for me, and now I'm going to check the conjunctiva. Alright, so it is a bright pink color. There's no ptosis, there's no little lag. Yeah. Everything seems to be intact. I'm now going to test for direct and constitutional light reflex. So Mr. Rex, I just need you to look directly at me, and I'm going to be shedding this light in your eyes and see how your eyes operate. So look. Alright, so the direct light reflex is I am doing that direct light reflex, and his pupils are dilating, as I can see. Now I'm going to check the other side. Yeah, so as I'm inspecting right now, as I shine the light into eyes, the eyes do constrict. Now I'm going to do the consensual. I'm going to hold this paper on one eye and shine the light on the other, just to see if they constrict when light is exposed to when the eyes are exposed to the light. Alright, thank you. Now I'll do the other side. Alright, so the pupils are constricting. Just to quickly measure, the pupils are about 3 millimeters, which is the normal size. As I did my test, the pupils are round, equal. The pupils are round, equal, reactive to light, and accommodate, which is the last thing we need to check. Mr. Rex, can you please look at this pen for me? I'm going to push it close to you and forward for you, and I'm just going to see how your eyes react. Is that okay with you?
Yeah.
Alright, cool. So look close, look right at this. As I do this, I can see these eyes converge at the same time. There's no lagging or anything. Now put the pen right back. Alright, so the eyes just dilated, which is expected, and his eyes are good to go. We are now gonna start with the one to the neck, his eyes are okay, which is the oculomotor nerve, also known as cranial nerve 3. Now we're gonna go on to the neck. All right, can you please put your neck up for me, Mr. Rex? Thank you so much. All right, so just from inspection, there's no scar, there's no bruising, there's no discoloration. We will check for any enlargement of the thyroid. The neck is midline to the head. There's no deformities. I'm just gonna quickly palpate for you. I'm gonna quickly palpate for you, just to check, enlargement of the thyroid. All right, so just put your head up for me. Can you please swallow? I'm just gonna palpate. All right, no tenderness. All right, there's no enlargement of the thyroid. You don't feel any pain, right?
No.
All right, cool. The temperature is even, and I'm just gonna quickly assess the carotid pulse, which is around the manubrium, submandibular area, just right under the jaw here. So I do feel a pulse. It is regular. Rhythm is regular. The strength is a 2, which is a normal. And now I'm going to check the other side, just for symmetry. It feels the same. All right. So the carotid artery does feel normal. I'm just going to quickly auscultate, but before then, I'm going to quickly rub my stethoscope with some alcohol rub on both sides, and I'll use the diaphragm to check the carotid poise and find out the rate. As I listen, I'll be assessing for bruit or if you have nervous swishing sounds. So, Mr. Red, all I need to do is just breathe in and breathe out and stay relaxed for me, please.
Okay.
All right. Thank you. So I'm just going to assess. All right, then the other side. All right, so for my observations, there's no thrills one more time. I'm just gonna quickly get the rate. So I'm gonna put my hands right here and start counting to find the rate of the carotid artery pulse. All right, so I will wait 30 seconds, and whatever number I find, I'll multiply by 2. In this case, it's 86, which is normal heart rate. I'm just going to quickly check for the strength, muscle strength of the neck, as well as range of movement motion. Mr. Rex, can you turn your head left and right? Left and right for me, if you can. Thank you. Up and down, if you can. Just do your best. All right, thank you. Chin to shoulder, just do your best. Chin to shoulder, like this. Yep. All right, thank you. Now I'm going to check for resistance. Mr. Rex, I'm just putting my hand right here. I need you to push towards my hand. All right, my guy's strong. That's good. And now we finish the neck assessment. Now I'm going to check the muscular system as well as the integumentary. I will be checking both sides for symmetry and no any deformities or anything off. Just for integumentary issues, I'm just going to check the skin. As I inspect, the skin looks uniform. It's moisturized. The hair is evenly distributed. There's no scars, lesions, or masses. And the skin is, there's elasticity. I'm going to check the skin turgor. So, Mr. Rex, I'm just going to get your hand here with it. I'm just going to pinch the skin. All right, so there's elasticity went back to how it was. I'm now going to palpate for muscles, for muscle definition or muscle bulk, and also check if there's any inflammation in the joints and so on. So I'm going to do this symmetrically or bilaterally so I can see the symmetry. So I'm just going to quickly press. There's no, let me know if you feel any tenderness or pain.
No pain.
All right, so as I'm touching his arms and legs, I see that there's no inflammations of the joints. There's no bumps, lesions, or bruit. No, not bruit. There's no bumps, lesions, or scars. I'm going to quickly check his legs. The skin is appropriate to the skin color. There's elasticity, there's moisture. Hair distribution is equal. There's no cyanosis. He has some muscle bulk as well. There's no atrophy or anything sticking out. He seems healthy to me. Skin is good. And we check the muscular system as well as the integumentary. I'm just going to check some range of motion with your joints as well. So, Mr. Rex, can you please put just one arm up? Alright, and down. The other arm, please. Up and down. Stick your leg out. Up, down. Alright, so as from my inspection, there's some range of movement. There's no limitations. Therefore, it's a grade 5 because he has no problems with moving himself. Therefore, he's healthy. And now that we assess the muscle and integumentary system, I also need to check resistance from the muscle as well. So, Mr. Rex, I just need you to put your forearm like this, and I want you to, I'm gonna push down, you push up. Alright, it looks like he's strong, which is a good thing. I'm going to also check your muscle strength. I'm going to put my 2 hands in front of you. I just need you to get both hands and squeeze as hard as you can. Yep. Here, let's put your glasses now. Yeah. Alright, so grab both my hands, put your both, grab my hands, and squeeze as hard as you can. Wow, my guy is strong. Or this patient is strong. He's healthy and well. We did a check-in message. Now we're going to move on to the thorax. The thorax, just by assessment, there is no accessory use of muscles. There's no heaving or wheezing. He seems to be breathing without any distress. There's no problems. We're just going to quickly check your breathing sounds. I'm hoping for no adventurous sounds such as crackling or wheezing or anything normal. And while auscultating after palpation inspection, I should be hearing some vestibular sounds, bronchial sounds, and a mix of both. And as I inspect or auscultate, I'll tell you what I'm hearing and continue from then on. So just by looking at the chest, there's no deformities. The ribs are downward. The intercostal space is about 90 degrees. I will check back in front. The skin looks moisturized. The hair is even. And yeah, the anterior posterior transverse ratio is 1 to 2. I don't see any barrel chest, which is the center COPD. And we'll get going. So I'm going to auscultate. I'm just going to palpate before auscultate actually, and I don't feel any throats, which is abnormal vibrations. That probably has to do with the heart, but I'll say that again. Yeah, nothing's sticking out. The slopes are downward. There's nothing sticking out. There's no deformities. There's symmetry. Yeah. Now I'm going to quickly auscultate from the front and also the back. So Mr. Rex, all I need you to do is relax and breathe in and breathe out when I tell you so. Is that okay with you?
Yep.
If you need water, you can let me know.
Sure.
Yep. I'm going to put on my stethoscope. I'm going to rub my stethoscope once more and warm it up. And we'll get started. So, we'll put on the diaphragm. Alright, and we'll start from the submandibular part of this body around the neck and work my way down with the Z-tract. So Mr. Rex, please breathe in and out. Breathe in, alright. Breathe in, breathe out, 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 breathe in, breathe out. And now the sides, please. Arms out for me. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. All right, now we'll also see the back. Just continue to stay comfortable and breathe in, breathe out from your face. Breathe in, breathe out, 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 breathe in, and breathe out. All right. So for my assessment for the thorax, or the breathing of the lungs, there's no respiratory sounds, just as I suspected. There's no wheezing, there's no heaving. The best sounds I heard were the vestibular, what about the peripheral sides of the lungs. That was a soft blowing noise, like the tree, and then you have the break around the artery, around the larynx and pharynx, which is very loud and hollow. And then mixture of both in the sternum. I checked both back and front, and there's no problems at all. I'm now going to check the precordium or the heart, and I'm just going to tell Mr. Rex once again, just to breathe in and breathe out slowly, and I'll assess accordingly and tell you my findings. I'm also going to be checking the valves as well. So I'm gonna find the sternal notch, and then find the angle of Louis. And from here, I should be able to feel the intercostal, the second intercostal space. After the second intercostal rib, you find it around here. Now that I found it, I'm gonna search for the heart valves and the heart sounds associated. All right, so all I just need you to do is breathe in and breathe out. All right, so I'm going for the aortic valve. Gonna find the angle of Louis, second intercostal space, and go from there. All right, can you please breathe in, breathe out. Actually, I'm gonna use the. Okay, I'll use the diaphragm to use this. Breathe in, breathe out. So we have the aortic valve on the right side of the sternum and the second intercostal space. Now I'm going to move on to the pulmonary valve on the second intercostal space on the left. All right. Third intercostal space downward. I'm going to feel the Erb's point. Okay, breathe in. Good job. Now, fourth intercostal space, I'm going to feel the tricuspid, midclavicular as a point of reference, and the mitral valve. All right, thank you. I'm just going to quickly palpate and check for thrills, which is a vibration of the heart, which is a sign of enlargement. Feeling vibrations. I don't feel any vibrations. From my observations, the heart is healthy. I'm hearing the S1 and S2 sounds, which is the lub dub. I don't hear any S3 or S4, which is a swishing or groovy. He seems like he's a healthy guy. And as I palpated, yep, there's no enlargements, there wasn't anything sticking out. And he seems to be a healthy guy. And we're gonna move on to the last session. Last part of our session is the abdomen. Mr. X, can you please light up for me?
Okay.
All right, thank you so much. All right, so we're just gonna inspect the abdomen. I'm gonna get my light real quick just to see the contour. From here, I can see that his belly is rounded. I'm gonna go behind him and just flash my light. As I see, there's no shadows or anything bulging, meaning there's no hernias or anything wrong. We're gonna inspect, also take then palpate. So we just inspected. As you can see, the skin is even. The hair is evenly distributed. There's some moisture. And there's no bruising or lesions, mashes, or bumps or anything. The temperature we can check. We can't really palpate, but the temperature we can check. And everything seems to be doing well. I'm just going to also tape now for the sounds of the abdomen, which includes hyperactive sounds of the intestine found in the lower right side of the abdomen or belly. When I also I'll be expecting to hear sounds or a frequency of sounds between 5 and 30, which is a sign of healthy abdomen. So I'm going to quickly do that real quick. As I also take some of the organs you might find in each quadrant include. So I'm going to start with the upper right quadrant. We're going to find the stomach and the spleen. I'm going to use my belt to also take actually. Wipe, heat up, all right. Okay, so we have this, we can find the belly and spleen in the right quadrant. The left quadrant, we can find the pancreas and the liver. Now going to the lower right quadrant, which is the hyperactive sounds. We'll press a bit harder, a bit deep. All right, so I do get the hyperactive sounds. They sound normal. I'll just assess for 1 minute just to make sure, which is the optimal amount for a healthy hyperactive sound with the intestine. Everything seems well. And now the left side, which includes the semicolon and the left ureter. All right, so it seems normal. I'm just gonna quickly palpate last just to see if there's any tenderness or any bulging. Mr. X, please tell me if you feel any tenderness or pain.
No.
No? All right. It doesn't feel too firm or distended, therefore it's healthy. And he looks like he's well. Mr. X, can you please get up? We're almost done. We're just gonna end everything. Thank you for your cooperation. Do you have any questions?
Oh, no, not at all.
You
So,
did great.
How did you go?
You're,
You think I'm healthy?
you're more than
Strong?
You're more than strong.
Good. In fact,
I'd like to thank you for your cooperation.
no problem.
And you did well. Continue to take care of yourself. And if you're a healthy patient, let's look at the camera and put a thumbs up. Thank you. Woo. Oh, it's 25 minutes. Oh.
It's okay, it's okay, it's okay. Tell the teacher, you know.